Hello everyone. So this is a new video and this is a structured discussion task. A structured discussion task is one of the stations that you may see in the exam, but this task doesn't involve a role player. It's just you and the examiner will have few questions regarding a specific scenario or a specific condition. So some people may find it difficult because they want a patient to talk with and interact and stuff, but some people may find it easier because it looks like a proper discussion with the medical terminology, and you don't have to be in lay language and show your reactions and stuff. But you should practice both types of the stations, because the exam you will find half of it like a structured discussion and the other half is role player stations. Okay, so this task is assessing the information gathering, communication with colleagues, patient safety, and applied clinical knowledge. And here the examiner will discuss with you regarding Natalie Bailey, a 28-year-old patient who came at 16 weeks for booking her first pregnancy. She's now 16 weeks and she's known to have bipolar disorder, which was well controlled on lithium. She stopped the lithium since she knows that she's pregnant. You have 10 minutes in which you should answer the examiner's questions and discuss the management plan of her care. So usually if this in this scenario, the examiner will ask you questions regarding the history, regarding how you will manage her antenatal care, intrapartum and postnatal period. And also the examiner may discuss with you regarding the lithium, because it's a kind of medication which sometimes has some concerns if we use in a pregnant lady. So you should be aware about the benefits and risks of using lithium in a pregnant lady. Okay. I got some examples from the possible questions that might be in the examiner's file. So the first question: what data from the history do you want to know about this patient to plan for her antenatal care? So if you got this question, so you need to explore that you would ask all the items about the history of the patient. And I have a specific video for the history or the information gathering. If you would refer to that, you will find all the items of the history there. So you can also list all these information to the examiner, but we would stress here on the things which are related to our condition. So what is bipolar disorder? It's one of the psychosis disorder, or we call it mood swings disorders. So the patient will have alternative episodes of mania and depression, and they have to be on mood stabilizers to keep their mood stable all the time. Okay, so if the patient has stopped her medication like 16 weeks ago, or once she knows that she's pregnant, so we need to know more about her current mood condition. We need to ask, how about your mood at the moment? Do you feel low? Do you lose interest of doing things you used to do? How about your appetite? How about your sleep pattern? Okay, all of these questions are very important in screening of any patient with any mental health issues. And if you are specific, you can ask, in the last couple of weeks or in the last 4 weeks, have you ever felt like that? So you tell the examiner, I would be concerned about her mental health issues, so I would ask her questions to screen about her mood swings. I will ask her about sleep pattern, appetite, if she felt any low or lost interest in doing things that she used to do. And also we need to ask about abnormal thoughts. if she felt like, that she needs to harm herself or to harm others, and if there is any previous trials or attempts of harming self or harming others. Um, so that's very important to ask. The other things in the history we need to stress on, like, because she's 16 weeks and she just came for booking, and that's unusual because we do expect the patient to come at booking before 10 weeks. Especially if this is her first pregnancy, they will be so excited, and they will just refer to the midwife once they have a positive pregnancy test. But why is this patient waited so long to come? So there might be a concern regarding any domestic violence or lack of support at home, or like, lack of communication between the patient and her healthcare providers, or sometimes negligence, or anything like, language barrier, anything like that. So we need to know the reason why she didn't come early, because now she missed all the screening that should be done in the booking visits. So we should do that now. Once we see the patient, we should do all the screening tests. And she also missed the time limit for the combined test for screening for Down as well. Okay. And added, like, on top of that, we need to ask about her family history. Okay, if any one in her history has any mental health issues, because that will explain like why she's having that at such young age. And also we need to ask about the normal things in the history, like, as we all know, like if she's having any other medical condition, like, if she has any surgical history, any support at home, does she smoke, alcohol consumption, and drug is very important in patients with mental health issues, because sometimes if they went into depression, they start to drink, they start to get drugs, so drug history and alcohol is very, very important in patients with mental health problems. Okay. So the second question, the patient has stopped lithium on her own decision, as she thought it would harm her baby. So what advice would you give her? So yeah, I tell her that lithium, yes, it can have some concerns, and also using lithium can cause one of the structural anomalies in the heart, in the baby heart, called Epstein anomaly. But I would tell her that, Epstein anomaly is not necessarily a result of using lithium. Sometimes it can come without using any medication. So stopping lithium does not, uh, 100% ensure that your baby will not suffer from a heart condition. Okay, that's one of the things. But on the other hand, if you stop lithium, that means it's more likely you will go into relapse. Okay. And even even though if you are using lithium, I think we would offer you something called the fetal echo, which is like, a scan on your baby heart to make sure that your baby hasn't developed any abnormality. But even though if your baby has been diagnosed with any heart problems, that should be fixed straight away after birth, and we would notify the baby doctor about it. Okay. So the advice is for her to start again on the medication until being seen by the psychiatric team and the mental health team. So she can't go without any medication. Okay. So that's the advice. And also we can assess her mental health condition at the moment with the scoring system PHQ-9 and GAT-7 to see whether she's developing any anxiety and depression at this stage. Okay. So how will you plan her antenatal care? Yes. This is a very important question because now she's 16 weeks and she's considered to be a high-risk pregnancy. And, from mental health point of view, the bipolar patients or the patient with any psychotic disorders should be followed in a consultant-led unit and should be followed by a multidisciplinary team. And this multidisciplinary team should be consisting of senior obstetrician, psychiatric health specialist, and perinatal health specialist, and also specialist nurse. And we should leave a note in her notes for the pediatrician to attend the delivery and examine the baby after birth. Okay, so her antenatal care should be in the hospital, and she will have more frequent visits than usual and more frequent scans. Because she's 16 weeks now, we would recommend to do all the screening tests today, including full blood count, blood group, viral screening, including hepatitis B and HIV, also to take bloods for syphilis screening, to do urine test and urine culture. And because she has missed her combined test, so we would recommend a quadruple test for Down. Excuse me. And we would offer her anomaly scan or anatomy scan between 18 to 22 weeks, along with fetal echo. And she should be offered serial growth scans from 24 to 26 weeks, every 2 weeks until 36 weeks. And for all of the patients with mental health issues, especially the psychotic disorders, we would do a multidisciplinary team meeting at around 32 weeks to discuss her case and management plan for her perinatal period. And this multidisciplinary team will include the people who are specified in her antenatal care, along with her GP, her community midwife, and her family and or friends, whichever closer to the patient. Okay. So the multidisciplinary team, if they decided that this patient is very high risk to develop any mental health crisis during the perinatal period, this patient should be admitted to the mother and the baby unit of the hospital until delivery. And also she should deliver in a consultant-led unit, okay? And in terms of lithium, she should stop lithium at the time of delivery, okay? And she would she should have continuous CTG, and also to avoid dehydration during the time of delivery. The aim is to deliver her vaginally unless obstetric contraindication. And in her postnatal period, we would involve the psychiatric team and the perinatal mental health team. And also we would advise her for the next pregnancy to be planned, and to be also for her to be seen in the preconceptional clinic to optimize her condition before getting pregnant. We might find any other type of medication which is more safe during pregnancy, so we can stabilize her condition on a different medication. Okay, so the last question, she's going to continue taking lithium throughout her pregnancy. What are the precautions would you take to avoid lithium toxicity? So lithium is one of the medication which has a very narrow therapeutic range. That means, like, a very tiny increase in the dose of the lithium or the concentration of the lithium in her blood, it might lead to toxicity. And usually when we would advise her, like, you know, if she's early in pregnancy, now she passed the first 3 months or the first 12 weeks of her pregnancy. But if some patient who came very early in pregnancy and she's on lithium, we would tell her if she develops any, like, you know, nausea, vomiting, or diarrhea, or anything, like, you know, that can lead to dehydration, she should notify her doctor, because there is a possibility that the lithium dose might be higher concentrated in her blood, and also she might develop lithium toxicity on that. Okay. And on the other hand, by the end of pregnancy, because of the you know, increase the blood flow and stuff and cardiac output by the end of pregnancy, so plasma concentration also may increase in relation to the red blood cells. So sometimes the lithium levels may fall by the end of pregnancy, and the doses might not be very sufficient for the patient. So she needs a proper monitoring of her lithium level all through the pregnancy. So we should have a lithium level every 4 weeks, all through the pregnancy until 36 weeks, to just make sure that we are going with a therapeutic range. And from 36 weeks till delivery, we would measure the lithium every week. As I told you, like, the plasma volume will be increased in to a great extent by the end of pregnancy. That's why we do it every week. And we should tell her about the symptoms of lithium toxicity, which can be, like, you know, nausea, vomiting, GIT upset, sometimes tremors, and arrhythmia. They are non-specific, but she should be aware to notify her doctor if she develops any of these symptoms. And if we find the lithium level is high, that will explain why she has the symptoms, and we can work against it. Okay. So as I told you, during delivery, the patient should stop the lithium completely, but when she should resume it, we will not resume it unless she's not going to breastfeed, because the patient who is taking lithium is not allowed to give breastfeeding. So that's very important safety issues. You should mention it. And also, before starting the lithium again, we should measure the lithium level, and that would be 12 hours after delivery. So again, the patient, once she's in labor, she will stop lithium completely. She will need continuous CTG, and after delivery, we need to measure the lithium level 12 hours postnatal, and the patient to decide whether to take lithium or breastfeed. Okay. And as I told you, we would involve the perinatal mental health team and psychiatric team in her postnatal period, and also for the next pregnancy, the preconceptional clinic is very important. Okay, thank you. If you have any question, you just put it in the comment. Thank you.